Hi, Michelle. My name is Katie. I'll be your student occupational therapist today. And then this is my CI, Nikki. She'll just be observing and giving me feedback on my performance as we go. So I see here you've been having some right shoulder pains. And what kind of pain has that been? Has it been pretty intense or?
Yeah, it's kind of like a sharpshooting pain on my right shoulder, and it started about 6 weeks ago.
Okay. And when you say on your shoulder, where on your shoulder? Is it more frontal or is it back?
I would say more backside.
Okay.
Yeah.
And it started 6 weeks ago. Has it increased progressively or?
I would say that the pain kind of gradually came on throughout the 6 weeks, and now it's the worst that it's been.
And is that pain constant or is it just with movement?
At rest, it's like a 1 out of 10, I would say, but during movement, I would say it goes up to a 7 or an 8 out of 10.
So it's pretty intense.
Yeah.
And with that, does the pain go up with a more extreme motion, such as a reaching, or is it just same pain throughout, no matter what you're doing?
I can't really pick out what motions it spikes up to an 8 out of 10, but generally just when I move my arm anyway to the side, it hurts. Up above my head, it hurts.
Okay.
But it's hard to pick out exact motions.
Okay. I'm going to ask you a couple of questions really quick about your home setup. And just more or less, do you have things that are up on high shelves, such as books or papers?
Yeah, I do. I have, because I'm a high school student, so I have a lot of books, and I'm applying for college, so I have like a big book that I need to grab because I study from it a lot. So I always ask my parents to come and do that for me. Or I try to use my left arm, but the pain kind of, whenever I try to reach my left arm, I feel it in my right sometimes as well.
So you'll have pain there when you're moving both arms sometimes?
Yeah, if I move it in a certain way, if my shoulder like drops too low, then it kind of hurts on my left shoulder too.
Okay. And have you had any difficulties getting dressed, brushing your teeth, basically anything that you would do in your daily life with that right hand?
Yeah, so I'm a righty. I write with my right hand and stuff, but so then it's painful if I do write. So I've been trying to type a little, but that's still a little painful as well. So I kind of have to learn how to use my left hand for more things, such as brushing my teeth and washing my hair. And getting dressed is super painful because I do have to reach my arm up above my head. So I will ask someone to help me get dressed.
And the people that you ask to help, does that mean your parents?
Yeah, at home it's my parents. And then if I'm at school, I'll ask my friends to kind of help me carry some books, or I'll try to carry my left hand. Yeah, and my backpack is super painful to be on my right side, so I mostly just put one strap on my left side.
Okay. Would you say that you have a good support system between your parents and your friends? You have people that can help you no matter what?
Oh yeah, my friends are super helpful, and I'm allowed to leave class early if I need to take more time just because I can't carry all my books in my bag, so I have to stop at my locker between classes and grab my books, so it does take me extra time. So my teachers are also super helpful because they allow me to leave early.
Okay, that's good. It's good that you've given yourself time to get from place to place. And being that you are 17 years old and in high school, I assume you're fairly active when you're not in school.
Yeah, so I am on the baseball team. Now I can't be a part of it right now because I do have this painful shoulder. So I did practice a lot, probably 5 days a week for 2 hours. And I was still trying to continue my practice with the shoulder pain, and then it just got super bad, so I had to stop. But I'm a pitcher, so when I do pitch and throw, it's super painful, so I had to stop.
So you haven't been playing baseball recently?
No, yeah, because it hurts too bad.
About how long ago did you stop?
Probably like a week ago.
Okay, so still
Yeah.
fairly recently.
I thought it would get better, but it hasn't gotten any better. So that's why I decided to come to PT.
And are you hoping to, with PT and OT to get back to being able to play baseball?
Yes, I am. I really want to get back because all my friends are playing baseball, and I really want to get back on the team.
I would imagine that's very important for
Yeah.
you, and good time for you to have some social interaction with your friends. So
Yeah.
we'll definitely work towards getting you to that. Before coming to OT, have you had any other treatments done on the shoulder, like chiropractic or?
No, so I did. I saw my doctor, and he kind of referred me to see an OT just because I was in a lot of pain, and they told me that I should probably rest, and I've been icing it a lot, and that's it.
All right. So you haven't had any other form of intervention?
No, but I have been also taking ibuprofen. I try not to take it too much just because I don't like to take a lot of medications, but if I really need it, then I'll take it.
All right.
Mm-hmm.
Well, it sounds like you are a fairly active, young 17-year-old. So what we'll do throughout therapy, we'll give you some exercises, techniques to help strengthen your arm. Just from this initial meeting, I'm guessing that some of your pain is coming from the sport that you play, baseball. It sounds like you've been putting a lot of strain on that shoulder. So we'll look into that and see if we can't decrease your pain and help you get back to doing the things you want to do.
Okay, thank you.
Thank you.
All right, that was really good. I think you got a lot of really good information. You're very empathetic. Reflective listening was good. You used a few I statements, if anything. I would say maybe a few more I statements, but otherwise, overall, it was really, really good. I think you clarified a lot of things throughout to make sure you really understood what the patient was saying.
Awesome. Thank you.
Hi, Katie. I'm your student physical therapist. I'll be working with you today. It looks like you had a total knee replacement.
I did, yes.
Okay, perfect. So that was about 10 days ago.
Mhm.
So now, are you back at home or are you still in the hospital?
I'm back at home.
Okay. And let's see. You live in. I didn't have any notes about your living environment. So do you have any steps to get in your house?
I do. I have about 8 steps to go up and then 8 steps to go down to my basement.
Okay, so it's just like a ranch style house.
Kind of more like split level.
Split level. Okay, so as soon as you walk in, you have to go up or down.
Yeah.
Okay, that makes sense. Do you have any difficulties getting up and down the stairs? Did they educate you that in the hospital?
They ran through it a little bit, but we didn't have super extensive. What happened when I got home was my very strong grandson helped me up the stairs and again carried me down the stairs.
Okay.
But as far as moving on a flat surface, I'm doing great.
Okay. How was getting into therapy today? For traveling, for the car, are you okay getting into a vehicle?
I didn't have very many troubles, no.
Okay. But you have someone driving, correct?
Yes, my grandson.
Good. Just wanted to make sure. So anything else? Do you have a step to get up inside the threshold of your house?
There's like a half step. It's not a full one.
Okay.
It's kind of like a ledge.
Okay, and then the steps to go upstairs and downstairs, is there a railing at all?
There's a railing on the right side.
And then, so you have to go up. Do you have at least like main floor, laundry, bathroom, and bedroom?
Bedroom, kitchen, and a bathroom are on the and living room are upstairs,
Okay.
and there's laundry rooms downstairs.
Okay, so once you get upstairs, you're not going to go anywhere else?
No.
Okay, and then is there someone else? Is your grandson helping you at home?
Yes, he's living with me right now while I'm recovering.
Okay, good. So you have someone there to help you, take care of your laundry and stuff like that?
Yes.
Okay, perfect. So before your surgery, what led you to have a total knee replacement?
I was having chronic knee pain,
Okay.
and from what the doctors described, I just had destroyed the cartilage in that knee over time.
Okay, so just more of a degenerative?
Yeah.
All right, that makes sense. Before surgery, what was your level of function? Did you go on walks daily? I mean, what was your activity level like?
I was able to walk a lot. I have a job that requires me to stand
Okay.
very often, so I do that for most of the day when I'm not at home.
Okay. Do you do any other exercise or anything like that?
No.
Okay. Was your pain pretty debilitating before the surgery?
Yes, I would have to sit down a lot.
That makes sense. So you said you stand at your job a lot.
I do.
So what are you doing for a job?
I'm a greeter at Walmart, and my boss did say I can come back to work and take some and stay sitting when I'm cleared from therapy. So I really want to get to that if I could.
Okay, that makes sense. Can you have a chair at work for most of it? Like if you ask for one, when you're back. That way you can kind of maybe stay off your feet a little bit more.
Yes.
So that's okay. Okay, good. Let's see. Did you do a lot of things with your friends or family before surgery?
With my family, yes. We would go out to dinner every so often, picnics, that sort of thing.
Okay. So were you pretty? It seems like you're a pretty active person.
I would say I was fairly active.
Okay. And I'm assuming that's kind of what you'd like to get back to.
I would love to, yes.
Okay. What are some goals that you maybe have for therapy?
Well, I definitely want to start walking with a cane as soon as possible.
Okay.
I feel like I'm already done and graduated from the front wheel walker.
Okay.
I've been moving around fine.
Okay. What about like getting back to activities? Like any hobbies that you want to get back to?
I would love to be able to walk my dog again. That would be my 1 mile walk in the morning.
Okay. What kind of dog do you have?
I have a little corgi.
Okay. So that's not super active dog.
No.
All right. And your grandson's helping you with that dog too?
Yes, he's taking care of my dog right now.
Good. Did you have any significant previous medical history? Any heart attacks in the family?
There's history of heart disease in my family. I've been lucky enough to not have a heart attack, but I do suffer from hypertension.
Okay. Are you taking medication for that?
Yes.
And it's pretty controlled?
Fairly well controlled, yes.
Okay. Have you had any other major surgeries?
Not recently, no.
Okay. And then anyone in the family have diabetes?
No.
Do you smoke or drink?
I do drink occasionally.
Okay. Let's see. So it sounds like we can get you back to maybe doing some of your activities. We can get you for that walk again, and then we'll kind of assess and hopefully get you using a cane, and definitely help you get those stairs. So that way you can do that yourself, and your grandson doesn't have to carry you. Do you have any questions for me?
Not that I can think of right off the top of my head.
Okay. Well, then we'll do some more evaluation, but it looks like we can get you back to functioning.
All right, Nikki, you can get in really well. I loved how you had really good eye contact and you were very patient with her. You asked her a lot of questions about her living environment, her family. Thought that was really helpful to get to know her as a person as well. And you took the time to listen to her a lot. You had really nice reflective listening strategies. You would repeat what she said to you, and that's really important. So nice job. Therapist today, how are you doing?
Good, how are you?
Good. So I see that you have some acute low back pain.
Mm-hmm.
Yeah. So I see that your primary physician referred you to see a physical therapist.
Yeah, it's been pretty bad.
Oh wow. How long have you had it for?
About 2 weeks.
2 weeks. Okay. And is there any injury and any onset? Can you remember?
Well, I'm a painter, so I was painting the
Okay.
outside of a house, and I fell off the ladder onto my butt.
Okay. So you didn't fall on your back.
No, I fell on my butt.
Okay. And then the pain kind of started when after that happened.
Yeah, it's been really bad with like at rest and at movement.
Okay. What is your pain at rest? What would you say on a 1 out of 10?
6 to 10 or 6 to 7. Sorry.
Oh wow. Okay. And then during any activity or
It's been so bad I haven't been moving really. I can't do
Okay.
anything. I've just been sitting.
so you're kind of bedridden a little bit.
Yeah.
And you haven't been working at all.
No, I haven't, which kind of sucks.
Okay. So you've been working for 2 weeks since the injury.
Yeah.
Yeah. Okay. Are you taking any medications for it?
I've been taking some ibuprofen, but that's about
Okay.
it.
Are you on any other medications?
No.
No. Okay. Do you have any past medical history, such as like anything in your family I would need to know?
I think my grandma had a heart attack, but that was it.
Okay. Okay. You're doing okay.
Mm-hmm.
Overall, how would you rate your health?
I'd say I'm pretty healthy.
Okay. Before the.
Before,
Insane.
yeah, I haven't. I mean, really, my husband's been making food for me, and I've just been laying on the couch, so that's it.
Okay. All right. And then have you done any other treatments beforehand before seeing me for your low back pain?
No, I just tried giving it rest, and the rest
Okay.
wasn't, and then the ibuprofen that wasn't working.
Okay. So you haven't seen any other PTs.
No.
All right. Okay. And then, so I see that you're a painter. Did you work a lot?
Yeah, I mean, now that it's not like snowing out, I can work a lot more. But in the winter, I can't work
Okay.
too much unless I'm doing indoor painting.
Did your back ever hurt before you fell?
I mean, sometimes it gets sore if I was doing ceilings and stuff like
Okay.
that, but nothing too bad.
And it's always the low back area.
Yeah.
Does the pain radiate ever, or does it normally stay in the low back?
Well, now that I fall, I kind of have it going like down my right leg,
Okay.
behind my thigh.
Okay. And that pain keeps going all the way until it hits the thigh, I see.
Yeah, it goes all the way down the back of the thigh into like the back of my knee.
Okay.
It stops there.
Does the ibuprofen help at all, or?
I mean, a little bit, but not
A little
too
bit.
much.
Alright. So before you had this injury, what would you say your exercise plan was? Did you have one? Did you exercise regularly?
Well, I go on walks a lot. That's what I used to do with my dog, but I can't really have to do that anymore. I'm a pretty active person, so I'd go hiking on the weekends or kayaking, but I'm not big like going to the gym person.
Mm-hmm.
Just
Okay.
more of an active lifestyle.
So more outside stuff.
Mhm.
Awesome. And then during just going around to your house, does it hurt doing anything around your house, getting out of bed, using the bathroom?
Well, I've kind of been basically sleeping in my bed, then going to the couch, and that's about it. So I haven't been doing much.
Okay.
So,
Is your bedroom on the first floor or?
yeah, we just have the one floor in our house and then a basement.
Okay. So have you tried using the stairs?
No, I have no reason to really go down there because
Okay.
we only do laundry, and my husband's been doing that. So,
Okay, that's good. That's good. What about just walking? How's the pain walking?
it's about a 6 to 7.
Wow, okay.
Mhm.
So you try to avoid walking. That's good. And I see that you have your husband that will help you at home.
Mm-hmm.
Okay, good. In your living environment. And then would you say that you're pretty outgoing? Do you go out a lot with friends or with your family?
Yeah, we usually go out on the weekends for like dinner and stuff, and then we'll meet up with our friends and stuff like that.
Okay.
Since we don't have kids, we're pretty active.
Oh, okay. Good. Okay. And then do you think that, well, now that you said you're pretty bedridden, do you think that your pain kind of stops you from getting out and doing
Oh,
stuff?
yeah. I usually
Yeah.
don't stay at home much, aside from like
Okay.
cleaning and like just doing house stuff. But yeah, so I can't really do anything anymore,
Okay.
which sucks.
Okay. I see that you did a lot of cardio. Did you ever do any strength training at all?
I mean, like every now and then, but I didn't really like go to the gym to like lift weights or anything. Like
Okay. So you just did it around the house and stuff.
Yeah, I mean, every now and then I'll do like circuits or something like that.
Okay. That's good. All right. So you probably want to get back to working, right?
Mm-hmm. Yeah.
So what would you say your main goal is?
I would like to be able to like just at least walk around a little bit, which would be nice. That way I could kind of take care of myself. My husband wouldn't have to worry about it, and then obviously like my end goal would be to get back to work and like where I was before.
Okay. All right. So do you have any like short-term goals you think that you want to achieve in the next few weeks, in the next week or so?
Probably just be able to walk around my house so that way I can like do my own like food and stuff like that, and like get out of bed and clean up the house a little bit without having my husband have to do it all.
Okay. Well, we'll try to get you there, and then we'll also try to decrease your pain too, since your pain is pretty up there out of a 10. So our main goal is probably decreasing your pain and just getting you able to walk again without any pain. All right.
Yep.
So yeah, I hope to get you to your goals as soon as possible. Okay. Does that sound okay?
Yeah, it sounds good.
Do you have any other questions or
No, I don't think so.
no? Okay.
Good job, Michelle. You had excellent eye contact with your patient the entire time, and you had a lot of empathy for your patient, for the pain that they were going